So welcome to my channel. Today we are diving into the topic of cardiac rehabilitation. Yeah. So rebuilding the heart and restoring life with cardiac rehabilitation, or simply saying CR. So this slide outlines of our key objectives like defining CR and its core components, understanding its phases and patient progression. So describing the physiotherapist's role in risk factor modification and exercise prescription, and identifying the evidence-based benefits of structured cardiac rehabilitation. Yeah. Coming to the empathy, that is the cardiac event experience. So let's talk about the cardiac event experience with some empathy. So patients often face constant anxiety about another heart attack, so wondering if chest pain is just indigestion. They lose confidence, fearing physical exertion, or even playing with grandchildren. So there is an identity crisis, moving from healthy to cardiac patient, leading to depression and withdrawal as well. So plus the overwhelm for new medications and lifestyle changes can be a lot. Understanding these emotions is crucial or for effective care as well. So, what is cardiac rehabilitation? So, it's a comprehensive intervention based on thorough patient assessment, followed by tailored therapies like exercise training, education, and behavior change. So, while this slide mentions the pulmonary rehabilitation, the principles apply to cardiac care, aiming to improve physical and psychological conditions and promote long term healthy habits. So, let's move forward to see how it is applied. Yeah, it is nothing but here's how cardiac rehabilitation is prescribed for different patients. So the first one is for a 55-year-old post myocardial infarction business executive stressed about work. So we use graded aerobic training to boost cardiovascular efficiency and exercise that is stress tolerance, plus intensive stress management and a healthy heart healthy nutrition as well. So what is the goal here? A safe return to work. Whereas the other case is nothing but for a 70-year-old post CABG retired feeling weak, we focus on functional strength training like sit to stand and carrying groceries, plus balance and gentle walking. So with education on wound care and medication as well. So what is the aim here? Regaining the independence in daily activities. Yeah, coming to the postural drainage flow chart, it is nothing but starting with the cardiac event, moving to the inpatient acute phase, then the outpatient supervised phase, and finally the community based maintenance. It is a structured pathway to the recovery in which we could explain in a flow chart manner. Yeah. Let's dive into the core components of cardiac rehabilitation. The patient assessment includes medical history, physical exams, and tests like 6-minute walk test and cardiopulmonary exercise testing. The exercise training features aerobic exercise, treadmill, cycling, walking that is prescribed at 50 to 80% of heart rate reserve, plus resistance training 2 to 3 days a week of strength, warm up, and cool down are critical for safety. This holistic approach is the key here. Yeah, what is the PT's role in exercise prescription and monitoring? The physiotherapist's role in exercise prescription and monitoring is vital. Using guidelines like AACVPR, they stratify risk and monitor ECG and BP during initial sessions. The FIT principle guides this, and 3 to 5 times per week, intensity based on symptoms, or else 40 to 80% of heart rate reserve, and 20 to 60 minutes of per session with aerobic and resistance types. Intensity is the most crucial parameter here, and which is tailored to each patient's needs. Yeah, coming to the MCQ, so it's nothing but time for some MCQs, which phase involves supervised exercise with ECG monitoring in an outpatient setting. So the answer is phase 2. And the second one, for a patient on beta blockers, the most reliable method of prescribing exercise intensity is the rating of perceived exertion, or Borg scale. So test yourself and let me know the answers in the comment section. Yeah. The other thing is a primary goal of cardiac rehabilitation is to reduce the risk of future cardiac events through lifestyle changes, not to cure the disease or replacement of medicines. So what's your take? Drop it below. So thanks for watching. If you enjoyed this, hit that like button, subscribe, and ring the bell for more. See you next time. Practice to ensure smooth transition.